The Omnibus Guidelines on the Implementation of Community Quarantine in the Philippines, with amendments as of October 15, 2020. Definition: Community quarantine refers to the restriction of movement within, into, or out of the area of quarantine of individuals, large groups of people, or communities designed to reduce the likelihood of transmission of an infectious disease among persons in and to persons outside the affected area. Enhanced community quarantine, on the other hand, refers to the implementation of temporary measures imposing stringent limitations on movement and transportation of people, strict regulation of operating industries, provision of food and essential services, and heightened presence of uniformed personnel to enforce community quarantine protocols. General community quarantine refers to the implementation of temporary measures limiting movement and transportation, regulation of operating industries, and presence of uniformed personnel to enforce community quarantine protocols. Modified enhanced community quarantine, on the other hand, refers to the transition phase between ECQ and GCQ when the following temporary measures are relaxed and become less necessary: stringent limits on movement and transportation of people, strict regulation of operating industries, provision of food and essential services, and heightened presence of uniformed personnel to enforce community quarantine protocols. Modified general community quarantine refers to the transition phase between GCQ and the new normal when the following temporary measures are relaxed and become less necessary: limiting movement and transportation, the regulation of operating industries, and the presence of uniformed personnel to enforce community quarantine protocols. New normal refers to the emerging behaviors, situations, and minimum public health standards that will be institutionalized in common or routine practices and remain even after the pandemic while the disease is not totally eradicated through means such as widespread immunization. These include actions that will become second nature to the general public, as well as policies such as bans on large gatherings that will continue to remain in force. On assessing the risks and containing the virus, asking the question, are we doing enough? Regularly and repeatedly is critical, says Dr. Maria Van Kerkhove, Technical Lead, World Health Organization. Key points of the updated guidelines released by the Interagency Task Force on Emerging Infectious Disease, or IATF, regarding various quarantine classifications. Let's go over them. As to movement of people, during the ECQ, strict home quarantine is required. So this means that everybody should be at home. Restricted movement only for accessing essential goods and services. So the movement should be only for the essential goods and services. Exception for workers and offices or establishments permitted to operate. Persons below 15 years old, over 65 years old, are those at high risk for contracting the COVID-19 disease with immunodeficiency, comorbidity, or other health risks, and pregnant women are required to stay home. In the old guidelines, the persons below 21 years old and over 60 years old are prohibited, but now persons below 15. And ECQ, strict home quarantine, restricted movement, and only for accessing essential goods and services are allowed. Exception for workers and offices or industries permitted to operate. Persons below 15 years old and 65 years old and above are those at high risk for contracting the COVID-19 disease are required to stay home. The same thing with the GCQ, restricted movement, persons below 15 and 65 years old and above, and visits to open-air memorial parks and cemeteries up to 10 persons per group. MGCQ, restricted movement only for accessing essential goods and services, and for workers and offices or industries permitted to operate. Persons below 15 years old, the same thing. As to travel and transportation, for ECQ, public transportation is suspended. Shuttle services for employees of permitted offices or establishments, as well as point-to-point transport service, granted permissions to operate by the government, with healthcare workers and other frontliners given priority. MECQ, Public transportation suspended, same thing. Shuttle services for employees of permitted offices or establishments, as well as point-to-point transport service granted permission to operate by the government, with healthcare workers and other frontliners given priority. Private transportation such as company shuttles and personal vehicles allowed, subject to the guidelines provided by the Department of Transportation. Biking and non-motorized transport encouraged. GCQ. Public transportation is allowed with strict 1 meter social distancing between passengers. MGCQ, public transportation is allowed with strict 1 meter social distancing between passengers, and private transportation allowed subject to the guidelines provided by the DOTR, or Department of Transportation. Hotels and leisure. During the ECQ, they are closed except when issued with certificate of authority to operate by the Department of Tourism. MECQ, the same thing. Malls and shopping centers under limited operation. Leisure establishments and services closed. GCQ, closed except when issued with certificate of authority to operate by the DOT. Malls and shopping centers under limited operation, same thing. Leisure establishments and services closed. MGCQ, only those accredited hotels and accommodation establishments, and only upon issuance of a certificate of authority to operate by the DOT are allowed to operate. Gatherings. ECQ, mass gatherings are not allowed. Only mass gatherings that are essential for the provision of government services or authorized humanitarian activities permitted. MECQ, religious gatherings highly restricted, maximum of 5 persons are allowed. Non-essential work gatherings are prohibited. GCQ, religious gatherings are limited to 10% of the seating capacity or up to 10 persons, whichever is higher. Non-essential work gatherings are prohibited. MGCQ, 50% of the seating or venue capacity for movie screenings, concerts, sports events, and other entertainment activities, religious services, and work conferences. Schools. ECQ, face-to-face or in-person classes are suspended. MECQ, the same thing. GCQ, the same thing. For academic year 2020-2021, the Basic Learning Continuity Plan of the Department of Education and the recommendations of the Commission on Higher Education for higher education institutions shall be adopted. MGCQ, limited face-to-face or in-person classes may be conducted. Strict compliance with minimum public health standards and consultations with local government units and guidelines set by the Commission on Higher Education. Basic Learning Continuity Plan of the Department of Education adopted. As to work, ECQ, in full operational capacity are essential industries such as hospitals, health emergency and frontline services, manufacturers of medicines, agriculture, delivery and courier services. Operating at 50% capacity, you have essential goods and services establishments, media establishments, workers accredited by the Department of Transportation to work on utility, relocation, and railway projects. Those who are to work on a skeleton workforce, they are the following: other medical, dental, rehabilitation, optometry clinics, veterinary clinics, bank money transfer services, capital markets, water supply and sanitation services and facilities, energy and power companies, etc. MECQ, essential industries, media establishments, BPOs, e-commerce companies, postal and courier services, rental and leasing, recruitment and placement sectors, housing services are permitted to work at full capacity, with others operating at the 50% capacity. Work from home and other flexible work arrangements encouraged. GCQ, the industries are categorized. So for category 1, they are to fully operate. For category 2, they are to operate at 50% up to full operational capacity. And category 3 industries, they are to work from skeleton workforce to 50 operational capacity. For MGCQ, full operating capacity for work in all public and private offices, alternative work arrangements for persons who are 60 years old and above or those with other health risks. As to government service, during the ECQ, skeletal workforce on-site in combination with other alternative work arrangements is approved by the head of agency. We have MECQ, skeletal workforce on-site in combination with other alternative work arrangements is approved by the head of agency. GCQ, work in all government offices may be at full operational capacity or under alternative work arrangements. And MGCQ, work in government offices may be at full operational capacity or under alternative work arrangements. So almost all of the provisions are the same. Now let's go to the last, exercise in sports. During the ECQ, outdoor exercise not allowed. Okay, so these are for those who are into sports, like Sir Aris and Sir Pepito. MECQ, limited outdoor exercise, like walking, jogging, running, biking with face mask and social distancing, of course. GCQ, indoor and non-contact sports allowed, walking, jogging, running, biking, golf playing, swimming, tennis playing, badminton playing, equestrian, range shooting, and skateboarding. Minimum public health standards such as the wearing of masks and the maintenance of social distancing protocols, no sharing of equipment where applicable, are observed. Spectators and all non-contact sports and exercises are still prohibited. So the same thing with the MGCQ. Post-community quarantine scenario. Areas where no community quarantine is in place can be placed as being under the new normal. Let's now go to guidelines for interzonal and intrazonal movement. What is the difference between interzonal movement and intrazonal movement? Interzonal movement is the movement of people, goods, and services between provinces, highly urbanized cities, and independent component cities under different community quarantine classification. In intrazonal movement, the movement of people, goods, and services between provinces, highly urbanized cities, and independent component cities under the same community quarantine classification without transiting through an area placed under different classification. So these situations are allowed. Movement of all types of cargoes within and across areas under any form of community quarantine. Movement of authorized persons outside their residences or APOR, such as frontliners, authorized humanitarian assistance actors, returning or repatriated OFW, persons transported through the efforts of the national government. Transportation of uniformed personnel, government officials and employees for official business, OFW, students enrolled abroad or exchange visitor program participants, outbound travel of Filipinos regardless of purpose. Interzonal and intrazonal movement of persons not authorized outside of residences or non-APORs between areas placed under GCQ or MGCQ for any purpose shall be permitted, subject to the reasonable regulations imposed by the LGU concerned. The last part would be the general provisions. Grace period of 30 days from the last due date or until such time that the ECQ or MECQ is lifted for loans and rentals. LGUs enjoined not to cover workers, APORs, and necessary establishments in the application of their curfew ordinances. This means to say that the curfew ordinances should cover only those non-workers. Acts of discrimination upon health workers, repatriated OFWs, COVID-19 cases, and PUM shall be dealt with criminally, civilly, and/or administratively. All persons are mandated to wear masks, face shields, or other protective equipment. On the last note, on proper personal hygiene and containment, what we see being successful are the fundamentals of public health. Dr. Maria Van Kerkhove, technical lead of the World Health Organization. So that would be all, and thank you.